Hi, everyone. This is Inga Hansen, editor of MedEsthetics magazine, and we are going to go ahead and get started. If you have any questions during the webinar, please type them into the box on the right-hand side of your screen, and we will answer them at the end of the presentation. Today, we'll be discussing the benefits of LED-based phototherapy for skin rejuvenation and the Omnilux Contour FACE home-use LED device. Our presenter is Terry Wojak, Education Director of Glycola and founder of Aesthetics Exposed Education. She is an author, industry speaker, and has trained more than 5,000 estheticians and medical professionals on the importance of incorporating skincare into cosmetic medicine. Thank you so much for joining us, Terry.
Thank you for having me. Okay, so we're going to go ahead and get started, and thank you everybody for joining. We are going to be talking about the Omnilux Contour FACE. It is a new home-use phototherapy solution for providers and for clients. Okay, Omnilux Contour has reimagined LED therapy. So they're offering medical grade treatments in clinic and at home. This is the first and only flexible home use device that's clinically proven to deliver the correct wavelengths and energy to promote global skin health. The team behind Omnilux Contour is the same team that developed the leading professional LED device, Omnilux Medical. And the great thing about this Omnilux Contour is that it is FDA cleared for the medical indication fine lines and wrinkles. So the Omnilux Medical heritage, if anyone's heard of Omnilux, then you know that it is the gold standard of phototherapy devices in the physician and esthetician markets since 2003. There have been over 4,500 systems installed worldwide with more than 40 peer-reviewed clinical and research studies, and the Omnilux has more FDA clearances than any other brand. So a little bit about our world-renowned scientific advisory board. We have Dr. Glynis Ablon, Dr. Jared Jagdale, Dr. Klaus Fritz, and Dr. Daniel Siegel. And they're all the renowned experts in the field of LED phototherapy, and they work very closely with Omnilux. So what is the Contour FACE? Well, it's a flexible, portable, affordable home use mask that uses medical grade light to bathe the skin in red and near infrared light. So it's a flexible silicone material that wraps comfortably around the face. That's what makes it really nice too, is it's not big and bulky. It's not like a handheld device that you need to move around to different areas that needs to be tethered to the wall. This is a really nice, comfortable mask for clients to wear. It delivers the light directly to the skin, so it makes sure that all of the light is reaching its cellular targets and isn't being wasted. It has the 633 nanometer red light and 830 nanometer infrared. So it has the dual wavelength LEDs, and they're both on each diode, as you'll see on the mask. Every diode contains red and infrared light. It's portable as well. So not only is it comfortable, but it's portable. So I was actually cleaning the house yesterday when I had it on. You can watch TV, you can be on the phone, you can continue working, whatever you need to do, because all you do is it has that little handle and you can just put it in your pocket and you can walk around with the mask on. It is easy to use with quick and effective treatment. So the treatment time is only 10 minutes, which makes it great as well, because a lot of the other handheld devices, typically they'll take like at least 30 minutes because you have to hold them in each area, and sometimes there are 10 areas around the face. It does have the Omnilux Medical heritage, and again, it is FDA cleared for the treatment of fine lines and wrinkles. And that allows for clinical claims to be made. With those clinical claims, it gives the opportunity to combine with other skincare and aesthetic technologies as well. And it also has been tested and conforms to the medical device standard for photobiological eye safety. So some of the benefits of the mask. Clinical studies show that the greatest efficacy of light therapy is found with weekly treatments. LED is cumulative, the results. And with that, we know that our skin ages every single day, so it makes sense to stimulate the right cells on a regular basis, not just during clinic visits. So instead of them coming to the office for, like, say, a 20-minute treatment once a week, they're going to do 3 to 4 treatments a week for as long as they can. But our studies that we did were 4 weeks long, which we'll show you. Contour is the first home use mask that delivers similar efficacy to in-clinic professional products. So it has enough strength to give you those superior results without having to be in the office. The clients can use the mask as a standalone skin rejuvenation or as a booster treatment with other aesthetic treatments. So we know that LED, especially the red and the infrared, is really good post-microneedling, helps to calm inflammation, stimulate ATP to promote healing. It's very good after lasers and IPL, as long as all the wounds are healed. At that time, it helps to, again, calm down inflammation, help with the healing. It's good with chemical peels. If you are using it with chemical peels, just make sure that you're really neutralizing that peel properly. And then cosmetic ALA, which is a photodynamic therapy that we will talk about later on in the presentation. So enhancing both the results and the revenue is a win-win for the clinic and the client. So this is how it works. So basically there's like a Velcro piece in the back. It just conforms really nicely to the face. And you can see you could pretty much do anything while it's on. And I'm going to show you a quick promotional video that we have. And this promotional video can be shared with your accounts as well once we get the finalized version sent to you. Okay, so you can see how easy the mask is to use, and it's very easy for people to use at home. So there's not a lot to it. All you do is put the light on and press the button and turn it on. Okay, a little bit about the science. So our cells contain absorb wavelengths that cause a cascade of biochemical reactions. So what happens is when our cells accept the light, it stimulates the production of ATP. ATP is like energy for our cells. So just like a car needs fuel to run, our cells need ATP. And once we get that ATP, it leads to secondary reactions. And these secondary reactions include increased cell growth and migration, increased blood flow and tissue oxygenation, modulation of key cellular growth factors and mediators. And these secondary reactions are why we see those changes in the skin after light therapy. So here's just an image showing that you could see the red and infrared light hits the mitochondria. It stimulates the production of ATP. And then once that ATP is produced, you're getting growth factor production. You're getting extracellular matrix deposition because you're stimulating collagen and elastin production. You get cell proliferation, and you get cell motility. And this is just showing that through the cell membrane, we do have photoacceptors in our cells that help to produce that ATP as well. Okay, so the two wavelengths that we use in the Contour FACE are going to be the 633 nanometer red light and the 830 nanometer near infrared light. The red light penetrates 1 to 6 millimeters into the skin, and it is visible light, and that's the red light that you see in the actual Contour mask. It is the nearest wavelength to infrared. So it helps with cellular regeneration, cell proliferation, and growth factor stimulation. The red is also highly absorbed by fibroblasts, which helps to increase the synthesis of collagen. And you also get increased blood flow and tissue oxygenation. So you kind of get that stimulation of that circulation as well in the skin. That's going to help to revive it as well. And then the 830 nanometer light in the near infrared penetrates 6 to 9 millimeters into the skin. It is invisible light that has a thermal effect. And the cell membrane absorption stimulates complex cellular processes. So with the near infrared, you also get increased collagen, elastin, and growth factors. And you also get an increased blood flow and tissue oxygenation. So wavelength and distance to target. So we know that we have the clinically proven lights, the red and the near infrared for skin rejuvenation. But Omnilux Professional was the first device to publish papers using the two wavelengths, and today is still the gold standard in the LED sector. Omnilux also recognized that wavelength, intensity, dose, and proximity to the face are key parameters in photobiology. So Omnilux drew on these experiences to create the Contour mask. Advances in LED mean that now only one diode is used for multiple wavelengths, so that optimizes the space and intensity. So like I said, each of those diodes have both wavelengths on them. And the LEDs can be mounted in a flexible material, which allows them to be positioned closer to the skin. So here's just an example. You can see a regular powered LED compared to a high power LED, which penetrates deeper into the skin and spreads a little more. But if you look at the LED in close proximity to the skin, you're getting more light, and you're getting light spread out more, and it's getting deeper into the skin. So because you have that light effectively sitting on the face. So it's basically like the inverse square law. So an object that is twice the distance from a light source will receive 1/4 of the amount of energy. So if you think about it like a flashlight, you can shine a flashlight on the wall, but the further you stand back, you're going to get less photons emitted, and it's going to be more spread of light with less intensity. So if you have less intensity, you have less effective skin treatment as well. Okay, so we have two studies that were done on the Omnilux Contour FACE that we're going to go through, and this will help you to see what results your clients can expect. So the first study was the Omnilux Contour FACE with a hydrogel mask at 3 treatments a week for 4 weeks. And then we had another study with the Omnilux Contour FACE only at 3 treatments a week for 4 weeks. And I'll tell you about the hydrogel mask right after this study. So study number 1 with the hydrogel mask. There were 28 subjects that were recruited. 25 actually completed the study. And there were 26 females and 2 males with an average age of 49 years. 12% were Fitzpatrick 2, 80% were Fitzpatrick 3, and 8% were Fitzpatrick 4. So all the subjects were instructed to cleanse their face before the treatment and to treat their skin 3 times a week for 4 weeks at 10 minutes of treatment interval. And they weren't allowed to do any other skincare treatments during this time as well. The photography was captured using the Visia system at baseline and at 1 week after the last treatment. There was also position grading at baseline and at the final follow-up. Some of the mechanical evaluation used, they used the cutometer for elasticity, the corneometer for skin hydration, and the mexameter MC100 for pigmentation. And then roughness and texture were recorded using the VisioScan system. And also, subjects also carried out a self-assessment to the treatment. So they talked about their responses and their side effects, which there were no side effects. Okay, so here is the first chart describing the skin roughness parameters at the beginning and at week 5. So you can see even after the first week, there was about a 23% change in skin roughness. At week 2, about 17.5%. Week 3, 19%. Week 4, 24%. And week 5 was 50.5% change in skin roughness, which is really great. So here are some of the pictures that we have. So this one shows that visible reduction in skin redness and pigmentation, as you can see in the picture. And with the subject assessment, 96% agreed that their skin felt softer and smoother at the end of the treatment. And 96% of patients also agreed their skin felt plumper and more hydrated. Here was another surface evaluation of living cells. So with the evaluation of smoothness, there was a 38.7% average improvement. With the number and width of wrinkles, it was a 37.6% improvement. And then scaling was also calculated, and that came up with a 20.6% improvement. As for elasticity, the percentage change in 5 weeks was 21.4, or this is after the first week, sorry. And then hydration was at 18.9%. And then after the 5 weeks, 29.3% increase in elasticity and 19.4% in hydration. Here's some more before and after pictures. So you can see that the skin looks brighter, it looks more even, there's a reduction in redness. 96% of subjects said their skin looked brighter at the end of the treatment. That's one of the things I absolutely love about this mask. Every time I use it, even for 10 minutes, like your skin just glows afterwards. It looks amazing. It looks like revived and refreshed. And then 88% of subjects said their skin felt firmer and tighter. 92% of subjects agreed their fine lines were less visible at the end of the treatment, as you can see in this picture. And this is the Omnilux Contour Hydrogel mask. So this was used in that study we just talked about. And with this, it helps to enhance the phototherapy results, but also helps with the client experience. It's a really nice, soothing, cooling mask. So especially if you're doing the treatment in office or you're sending a client home with their mask to use at home, especially after a laser or IPL or chemical peel, the hydrogel mask is going to be really soothing and anti-inflammatory on the skin, and it's also going to boost results. The mask allows 87% of photons emitted by the LED to pass through into the skin. So how the clients would use it, or how you would use it in the treatment room: you would prepare the skin by obviously removing the makeup and cleansing. You can use an exfoliator as needed. And then the hydrogel mask comes in two different pieces. So you would apply it very evenly to the upper and lower half of the face, and you just smooth across the skin. It's very easy to apply. And then you would apply the Contour LED directly over that hydrogel mask, as you've seen in the video. So the hydrogel mask has glycerin in it. We know glycerin is a very great humectant, so it's going to draw water hydration to the site. It has niacinamide, or vitamin B3. That is going to be a water-soluble ingredient. It helps to reduce the appearance of enlarged pores. It helps with uneven skin tone. It also helps with fine lines and wrinkles, and it increases circulation, so it helps with that dullness of the skin as well. Hyaluronic acid, we know, holds 1,000 times its weight in water, so we have hyaluronic acid added as well for that extra hydration. And then there's a combination of green tea, ginger, licorice root, bergamot, chamomile, and schizandra fruit. And these all have antioxidant properties. Some have anti-inflammatory properties as well, like the bergamot and the chamomile. And then the licorice root also has pigment lightening properties as well. So again, it's going to give that nice brightness to the skin. Okay, study number 2. So this was using the Omnilux Contour with no hydrogel mask. There were 20 subjects. 16 were females and 4 were males. The average age was 49.5 years, ranging from 30 years to 69. 27% were Fitzpatrick 1, 36% were Fitzpatrick 2, 27 were Fitzpatrick 3, and 9 were Fitzpatrick 4. So like the other one, patients were instructed to cleanse and exfoliate their face prior to the treatment. No other treatment or skincare was allowed, and they did treatment times of 10 minutes, 3 times a week for 4 weeks. Subjects were photographed at baseline and 1 week after the final treatment. The skin analysis was carried out using the software analysis tool within the camera system. And the number of lines, wrinkles, pigment, redness, pores, and texture were all evaluated. And then subjects completed a baseline assessment of their skin and a final assessment at the end of the study period. And I think this objective is really important as well, because it really does matter. I mean, obviously we want to see those improvements on the camera. We want to see that physical improvement, but it's really great when our clients can come back and say that they really love the treatment and they would recommend it to other people. So results, there was an average reduction in lines and wrinkles of 18% from baseline to 1 week after the final treatment. The range was from 1 to 30% improvement. Skin texture improved by an average of 14%. Pores were diminished by 10% with a range from 2 to 24%. There was a reduction in redness with an average of 15%. And then pigmentation also improved in most subjects. So it was 16%. The baseline went anywhere from 6 to 47% improvement, but 2 subjects did not have any change in their pigmentation. So here is an image showing the average reduction in pore count. So it's you could see that 10% reduction, and this is after a 4-week course. No subjects had a pore count increase. Here you could see that reduction in skin redness. You can see it was visually obvious in most subjects with an average reduction of 15%, but every single subject saw some reduction in redness. We have this one for pigmentation. So again, 16% average. 2 subjects did not change and remained at baseline levels. However, the rest improved anywhere from 6 to 47%. And you could really see with this camera system the reduction in wrinkles on the skin. So again, that average reduction was 18% at week 5, and improvements ranged from 1 to 30%. So these are really great results, and you have to remember that these were only 4 weeks of treatment. So it was only 12 treatments because it was 3 times a week for 4 weeks. So our subjective responses, 89% of subjects said their skin felt softer and smoother after the course of treatment. 80% also said the skin felt more hydrated and appeared fuller or plumper compared to the beginning of the study. 84% agreed that their skin looked brighter and more refreshed compared to the beginning of the study. So the clinical data summary. So controlled studies to date had 45 subjects. There were no adverse incidents reported, which is great too. The light is very safe to use. We show improvements in global skin aging, fine lines, elasticity, surface skin texture, pores, pigmentation, and redness. You have immediate and longer lasting effects because you do, remember the LED is cumulative, so the real true long lasting effects are going to be over time. The subjective responses are typically positive with over 90% of subjects recommending the device to family and friends. It's easy to operate and convenient to use, and efficacy data is on par with many professional LED devices. Again, this has a high power to it, so it's really going to help to give our clients at home that same efficacy, or well, almost same efficacy as they would with that Omnilux Medical device. Okay, photodynamic therapy. So I spoke a little bit about this earlier, but there's a treatment that we have called Glycola. And Glycola is a type of photodynamic therapy, which means it's you're photosensitizing the skin to carry out an action, basically. So with Glycola, it is going to help with pore size, it helps with fine lines and wrinkles, it helps with texture. It is an amazing treatment, and the Omnilux Contour FACE activates it, which is huge because unfortunately, there are a lot of lights out there that aren't strong enough to activate it. So we do know that the contour is strong enough. So again, it's using LEDs, the light emitting diodes. You have your red and your near infrared lights. And the minimum intensity from the mask is 35 milliwatts per centimeter squared. And that's at a treatment time of 600 seconds or 10 minutes. Now, with the Glycola, the contour produces enough energy to activate the protoporphyrin 9 in 2 10-minute treatments. So, and it can be used in combination with that hydrogel mask as well. So let's go through the protocol for the Glycola. So with Glycola, what would happen is the client would, the provider would cleanse the client's skin and exfoliate it thoroughly with an oxygen scrub for maximum penetration. And then in a dimly lit room, the provider would apply Glycola with a brush, and then with gloved hands, massage it into the area for about 3 minutes. The product is then left on for 40 minutes in a dark room, and then the Glycola is removed with water and cotton pads. And this is the point where you can use the hydrogel mask as well. So the hydrogel mask works really good because with the Glycola, because we're photosensitizing areas of the skin, when you put the light on, it can be a little uncomfortable for the first few minutes. So putting on that cooling, soothing hydrogel mask, you're delivering all those great ingredients to the skin, and you're also helping to soothe it so it's not going to be uncomfortable for the client during the treatment. So after you have the hydrogel mask on, you would put the contour LED directly over it, and then you would set your, you would turn your device on, and it goes on automatically for 10 minutes. So remember, with photodynamic therapy, it's 20 minutes, so that so you would just have to turn it on twice. And then after the treatment, apply an intensive moisturizing cream or a vitamin A, C, and E oil, and of course, sunscreen of SPF 30 or higher. And if you want more information on Glycola, I will have my email at the end of the presentation as well. It's an amazing new treatment, cosmetic treatment that is available. Okay, so the Omnilux Contour in competition. So competitor masks sometimes use cheap LEDs with broader bandwidth. The wavelengths may not have been clinically proven. They can have ineffective intensities, and very few, if any, have supporting clinical data. So if you are looking at other devices, always ask for that clinical data. Many use additional wavelengths. So we see wavelengths, we see green, yellow, amber, orange, purple, pink. These appear to have more treatment options, but only the blue, the red, and the near infrared have been clinically proven. So remember that. Many of the masks that they sell on the market are hard shell, which makes them very bulky and uncomfortable to wear. And then since they're not completely conformed to the face, like the contour, you get photon scattering, so that reduces efficacy. Many are tethered to a wall outlet and are not portable, so you wouldn't be able to move about the house. And many require eye protection because most aren't tested to that IEC standard for eye protection, for eye safety. The majority of home masks are not FDA cleared for sale in the USA, and many are not tested to FDA medical device standards, and therefore the safety is questionable. Contraindications for the LED contour mask is lupus erythematosus, photosensitive eczema or albinism, open sores, wounds, acne, red, irritated skin, psoriasis, anything with like open lesions or anything that would just get more irritation if you were to put something on the skin. Pregnancy or breastfeeding, no one is going to test it, so we're just not going to do it. Any photosensitive disorder, so there are different photosensitizing disorders that people can have, which makes them sensitive to light. And then medications that cause photosensitivity. So if a client's on medication, make sure you find out if that medication is photosensitive, because it could be antibiotics, chemotherapy drugs, diuretics, and St. John's wort is an herbal supplement that also causes, it's very photosensitizing as well. But for a full list of every contraindication, it's provided on the Omnilux LED website. So the website is right there available for you to look at. So how do you position it in your practice? Well, first, it can be offered to activate or boost Glycola treatment. So again, Glycola is that photodynamic therapy. So with that, it can be used to actually carry about that action, and then the client can take their mask home and use it at home. So that's going to give them better results because they're doing LED in conjunction with their photodynamic therapy on a regular basis. The red is what activates the Glycola, but having that near infrared with the red reduces side effects and gives a faster recovery. It's used at home to boost and maintain results. And then the client has their own mask to use at the clinic, so they can bring their own mask in if they're worried about sanitation and things like that. You can also offer it in a package with skincare or combination treatments. So combines perfectly with microneedling, with Botox and fillers. It helps to reduce the chance of bruising after needling Botox or fillers. It's great in conjunction with other skincare. So we obviously have skincare products that we send our clients home with to get the best results. And this is just going to be a boost to their already great skincare regimen that you're offering them. And then, of course, it's great after laser, IPL, radio frequency. Again, because that near infrared is anti-inflammatory, it's going to calm the skin. The red's going to stimulate that ATP. So after all of these treatments, you're going to get healing. So you're going to get improved outcomes, better healing, less downtime, and client satisfaction. And then you can also offer it as a standalone anti-aging device. So again, the provider can make medical claims because it is FDA approved for fine lines and wrinkles. It has a higher output than most professional devices out there. It's the only flexible mask with studies and FDA clearance for full face treatment of fine lines and wrinkles. And it has the Omnilux name and heritage. So the Omnilux Contour Advantage. Hold on, I see that we're experiencing. Okay, sorry. Most home use LEDs do not treat the entire face. Again, they're those spot treatments that need to be moved around. It increases treatment time. The client has to be, sitting next to an outlet. And again, it just takes a lot longer. Efficacy is poor because the treatment is user dependent. So especially, again, with those handheld devices, you can't always get them directly next to each other depending on the shape of them. So you may be missing areas as well. Many masks on the market have those hard plastic shells, which means they don't fully fit comfortably to the skin. Many home LEDs are not portable and require the user to be tethered to an outlet. Many contain wavelengths not clinically proven, Again, all of those other colors besides blue, red, and infrared are not clinically proven. And most home use LEDs use cheap LEDs that don't deliver the necessary intensity, wavelength, or dose. And also, most home use LED devices are not FDA medically cleared nor have studies, and the Omnilux Contour does. So here are just a few testimonials. So Sarah from the UK says, I adore it. It's brilliant as I can travel with it for work. I love how lifted my skin feels after, and it has improved my small pigmentation marks. Whitney from California says, I've been a huge fan of Omnilux treatments at my dermatologist office for many years. The Omnilux Contour has far exceeded my expectations. My skin looks and feels great, and I could do the 10-minute treatment while I'm at home watching TV. And then Yvonne from the UK says the results after a contour face treatment last longer than a facial, and the skin is already looking so much healthier and brighter. I love it. So here is some information on the tools that we have available for you. So we have a sell and informational leaflet for the client. We have a web page, so if you go to omniluxled.com/contour, we have in-office scrolls and banners, a great social media presence. We have press releases and the promotional video for use in e-media. So the promotional video is the video I showed you earlier. All right, so the Omnilux Contour opportunity, it's an affordable, safe, effective, medically cleared FDA device that can be combined with virtually all treatments in the clinic. Sorry about that. That was my dog. He got out. Okay, a safe and effective tool for standalone skin rejuvenation treatments at home. It does activate the Glycola and other light-activated topicals. It improves outcomes for all treatments, which means a higher client satisfaction, which means more business for you. It's a significant differentiator from your competitors. It encourages clients to invest in a full package of treatments with home care. I think this really, too, drives home the importance of home care with these, with having a device like this and with their professional home care products as well. And especially during this time when a lot of the providers were not able to see our clients at this time, this is something really great to help keep up your clients' results at home and to also keep your revenues up. It's excellent word-of-mouth potential from end users, and it's a serious revenue profit opportunity for your business. Okay, so let's see if we have any questions.
Hi, Terry. This is Inga coming back on. Thank you so much. And we do have a whole bunch of questions that have come in. So I just want to quickly let everyone know that if we don't get to your question right now, we will follow up with you. We will reach out to you, make sure you get an answer. And if anyone wants to review the webinar or share it with a colleague, this will be available on our website, medestheticsmag.com/webinar by the end of the day. And several people were asking about what is the cost of the contour mask and how do you clean it and sterilize it between uses?
Okay, so the cost is $450 retail, and then if they're going to be wholesaled, they would get 5 for $13.75. So if they were just buying 1 or 2 masks, it would be $450 each, and then anything over that would be 5 for $13.75 for the wholesale, if that makes any sense. And how you clean it is just with alcohol. Alcohol wipes, clean it thoroughly on the inside. And most of this too, they're going to be, these are mainly going to be masks for each client to use. But of course, if they are used in the treatment room, they would need to be sanitized.
In between. Sure.
In between. I mean, of course, they need
to
sanitize them at home when they're their own as well. They can't just leave it. But yeah, I'd say like once a week to just clean it with alcohol.
Right, and that is safe for the material to do that alcohol wipe, though.
Yes. Yes.
Great. And another question we had is, you had mentioned that the treatment time is recommended at 10 minutes unless you're doing the Glycola. Is there any danger or risk to using it for longer? Is longer always better, or is that contraindicated?
No, longer is not always better, but it's fine to do it longer. It's really going to you can't get too much of the LED light because all it's doing is helping your cells work at the optimal function. So you can use it every day if you wanted to. You can use it. I've been using it 20 minutes a day, so you can use it as often as you want.
Oh, good. And is this available or approved in Canada and Europe as well as in the U.S.?
I believe it's available in Canada and Europe. I don't know if it's approved. I don't know if it is, but I think it is available in Canada and Europe. I'd have to check with that because we're the U.S. distributor.
Sure. Okay. And you had mentioned, and I think it's pretty well known that the LED and the near infrared are very good for healing and inflammation. And there's a question of if you're doing a resurfacing procedure where you want to create that controlled injury and inflammation, how long should you wait before you have someone use the mask again?
So that depends on how deep the injury is. We want to make sure, so resurfacing lasers, there can be anything from 1 day of downtime to 10 days of downtime to 2 weeks of downtime. So really when the skin has healed over, when the epithelium has healed over is when you can start doing LED again.
And what is the estimated lifespan of one mask?
The estimated lifespan, I'm not sure about that, but we do have a 2-year warranty. It's 1 year for the battery, 2 years for the actual mask.
Oh, okay. And is this safe for a patient who has melasma?
Yes, it is.
And what do you recommend in terms of the time between? I'm sorry, what?
No, I just said it's actually good for pigmentation.
Oh, good. And if you're using it either alone or with the Glycola, what is the recommended treatment interval between sessions?
So with Glycola, the treatments are every 4 weeks. If you're using it on its own, as often as you can use it, like I said, like every day a week. The protocol is 3 days a week for 4 weeks is what we did the studies with.
And can you ask, people are asking, can you take the mask and sort of put it on the neck or put it on your hands to get some of the same improvement? And are there any plans to create off-the-face home use devices?
That I cannot speak to, but you can definitely use it right now. I use it on my neck sometimes too in the décolleté. It's completely fine as long as you, just cover the area with it. You can use it anywhere.
Use anywhere. Great. And I think I'm just going to check. Oh, there were some questions. A few people asked about what is the difference in terms of energy output if you look at the home use mask versus a professional in-office Omnilux device.
So the professional in-use Omnilux device, I don't have the specs off the top of my head, but I know that the Contour is 35 milliwatts at least per centimeter square, which makes it, the only way I guess I can compare it is it activates the Omnilux Medical activates Glycola in like 6 minutes, and the mask takes 20 minutes to activate it. So that it reaches about the same amount of energy in 20 minutes that it would in 5 minutes from the 5 to 6 minutes in the Omnilux Medical.
And you had mentioned that this doesn't require any cord to be plugged in. So once the device is charged, how long is the battery life typically for that?
So about 14 10-minute treatment, so about 140 minutes.
Great, and this has been terrific, and we are running out of time, so if there are any questions we didn't get to, we will follow up with you to make sure you get an answer, and you can also reach out to Terry through her email, which is on the screen. And Terry, thank you so much for joining us.
You're welcome. Thank you for having me.
And thank you, everyone, for being here.
All right, and one more thing, I just did get a message.